Screening of patients in hospital emergency departments for concussions and other types of traumatic brain injury is challenging due to the many ways symptoms may manifest. Repeated studies have shown that emergency departments often fail to properly diagnose concussions, leading to the inability of individuals to receive timely or proper treatment. And even when a concussion is diagnosed, there is often a failure to assess the patient for a risk of future consequences, previously called the post-concussion syndrome, and now known as persistent post-concussive symptoms. A new study emphasizes the need to screen patients for ocular difficulties in the emergency department as an accurate tool to assess the risk of developing long-term post-concussion consequences. The study examines screening for convergence insufficiency symptoms. Convergence insufficiency affects the ability of both eyes to work together to form a single image, resulting from damage to the nerves controlling the eye muscles. Common symptoms include visual fatigue, double vision, headaches, or trouble concentrating. The study is entitled Convergence Insufficiency as a Predictor of Poor Prognosis After Acute Mild Traumatic Brain Injury, and is published in the International Journal of Emergency Medicine. A survey tool was created that asks study participants these questions. Do your eyes feel tired when reading or doing close work? Do your eyes feel uncomfortable when reading or doing close work? Do you have headaches when reading or doing close work? Do you lose concentration when reading or doing close work? Do you have trouble remembering what you have read? Do you have double vision when reading or doing close work? Do you see the words move, jump, swim, or appear to disappear on the page when reading or doing close work? Do you feel like you read slowly? Do your eyes ever hurt when reading or doing close work? Do you feel a pulling feeling around your eyes when reading or doing close work? Do you notice that words blur or come in and out of focus when reading or doing close work? Do you lose your place when reading or doing close work? And do you have to reread the same line of words when reading? The answers are scored as never, infrequently, sometimes, fairly often, and always, with different point values attached to each category. The study found a positive correlation between high scores and development of post-concussive symptoms at 30 and 40-day follow-ups. This suggests that this tool can be used as an effective way of risk stratification for the development of persistent post-concussion symptoms. Other studies examining ocular disturbances also found a strong correlation between these symptoms and cognitive brain damage. Early identification of patients at risk for the development of persistent post-concussive symptoms is important in developing proper treatments and improving outcomes. Thank you for joining me this week, and I look forward to meeting with you again next week on a new edition of the Brain Injury Insider.